Welcome to the Reimagine Healthcare podcast. I'm your host, Noah Volz. So I want to ask you something. When you think about the future of Southern Oregon, 10 years from now, 20 years from now, who do you see here? Do you see young families putting down roots, teachers staying for their whole careers, your kids choosing to build their lives here, healthcare workers serving the community for decades, or do you see something else? Older population, fewer workers, closed schools, businesses struggling to hire, the best and brightest leaving for Portland or Eugene or out of state? Because right now, we're heading toward that second future. And the driving force? It's not wildfires, though those matter. It's not housing, though that's huge. In my opinion, the biggest single factor determining who can stay, work, and age in Southern Oregon is healthcare affordability. Let me give you the data. Since 2019, we've lost an estimated 3,400 working age residents who cited healthcare affordability as a primary or contributing factor in their decision to leave. 3,400 people. That's equivalent to losing the region's 8th largest employer. Except these workers aren't being replaced. And if current trends continue, we'll lose another 8,200 residents by 2030. Working families, young professionals, experienced workers in their peak earning years. The people we need to keep this region economically viable. This isn't a prediction. It's a projection based on data we're seeing right now. And today, I'm going to walk you through exactly what's happening, who's leaving, why they're going, and what it means for the future of this region we all love. But here's the thing. This is not inevitable. Other regions have faced this exact crisis and turned it around. There's a playbook. There are solutions. But we have a window of about 2 years to act. After that, we're looking at demographic decline that could take a decade or more to recover from. So, let's talk about the future of Southern Oregon. Let's start with what's already happened. Between 2019 and 2024, Southern Oregon's total population dropped from 377,000 to 373,200. That's a loss of 3,800 people. Doesn't sound catastrophic, right? But here's what that number hides. Our population over 65 grew by 4,600 people. We're getting older. Meanwhile, our working age population, ages 25 to 64, declined by 3,080, and our school-age children dropped by 2,200. So we've lost over 5,000 working age people and kids while gaining retirees. That's not healthy aging in place. That's a migration of the economically productive out of our economy. We did exit surveys with people who left. 48% cited healthcare costs or access as a primary factor. 48%. That was the number 2 reason people gave for leaving, right after overall cost of living. And guess what's the biggest component of cost of living after housing? Healthcare. Conservative estimate? Healthcare affordability was a substantial factor in over 5,000 relocations. That's more than one person leaving every single day for 5 years because they couldn't afford healthcare here. So, who are these people? Young professionals, ages 25 to 34, make up 38% of the people leaving. These are folks establishing careers, starting families, buying first homes. We lost 1,800 people in this age group. Established workers, ages 35 to 54, are 44% of departures. These are people in their peak earning years, peak productivity, peak community contribution. 12% of the people leaving are ages 60 to 64. I'm going to come back to this group in a minute, because their story is particularly heartbreaking. Now let's talk about occupations. Of the working age people who left, 28% were healthcare workers. 28%. We have a healthcare worker shortage, and we're losing healthcare workers because they can't afford healthcare. Think about that paradox for a second. 18% were education professionals, teachers, administrators, support staff. 16% were skilled trades, electricians, plumbers, HVAC techs. 14% professional services, 12% technology workers. These are exactly the occupations where we have the worst shortages. We can't fill these positions, and the people already in them are leaving. Where did they go? 43% went to the Portland metro area, 20% to Eugene Springfield, 12% to Bend, 25% out of state, mostly Washington, Arizona, and Nevada. They went to places where the total compensation package makes more sense, where healthcare costs don't consume a quarter of their income, where they don't have to choose between using their insurance and paying rent. Among the people who cited healthcare as a factor, here's what they said specifically. 78% mentioned high insurance premiums and deductibles. 52% talked about limited specialist access. 48% cited provider shortages and wait times. 34% were dealing with medical debt concerns. These aren't people who wanted to leave. In the exit surveys, when we asked people who cited healthcare, if healthcare were more affordable here, would you have stayed? 64% said yes. They loved it here. They wanted to stay, but they couldn't make the math work. Now let's talk about what this costs the region. When you lose working age adults, you lose their economic contribution. Based on average economic contribution by age group, the people who left between 2019 and 2024 were generating about $1.3 billion annually in economic activity. That's gone. That's $1.3 billion a year that's no longer circulating in our economy. Tax revenue? We've lost about $12 million a year in property tax, $28 million in state income tax, another $6 million in spending-related revenue. And the people who moved here? They skew heavily toward retirement age. Retirees contribute less economically than working-age adults, average of about $42,000 a year versus $78,000 for working adults. So we gained about $595 million in annual economic activity from the 12,400 people who moved in. We lost $1.3 billion from the 16,200 who left. Net loss, $743 million in annual economic activity every single year. Compounding. So where does this lead? We've modeled 3 scenarios for 2030. Scenario A is status quo. Current trends continue. No coordinated intervention. Healthcare costs keep growing at 11.5% a year, while wages grow at 2.8%. What happens? We lose another 8,400 people by 2030. Our working age population drops by 11,300. That's a 7.3% decline. Young professionals, ages 25 to 34, down 10.2%. Pre-retirement folks, 55 to 64, down 11.1%. School enrollment drops by 2,400 students. We lose $14.7 million in school funding. We're looking at 3 to 5 school closures. Tax revenue drops $54 million a year. Economic output declines by $680 million annually. Our workforce shortage goes from 4,200 unfilled positions today to 5,340. That's scenario A. That's where we're heading. Scenario B is modest intervention. Some employers take action, there's limited state policy support. Healthcare costs still grow, but at 8.5% instead of 11.5%. Outmigration gets reduced by 25%. In this scenario, we still lose population, down 3,540 by 2030. Working age population drops by 7,000. We still close 1 to 2 schools. Tax revenue is still down $32 million a year. Better than scenario A, but we're still declining. Scenario C is comprehensive coordinated intervention. This is the Spokane model, which we'll talk about in detail later. Regional employer coalition, state policy support, provider engagement. Healthcare costs grow at only 5.5% a year, closer to the state's target. In this scenario, we gain 6,240 residents by 2030. Our working age population grows by 5,500. School enrollment goes up by 2,200 students. We might reopen closed schools. Tax revenue increases $18 million a year. We reduce our unfilled positions by 30%. The difference between scenario A and scenario C? 14,640 people. $1.1 billion in annual economic output. The future viability of this region. And here's the critical thing about timing. If we act now, we can achieve scenario C by 2030. If we wait until 2027, we can get somewhere between B and C. If we wait until 2028, we're locked into scenario A, and recovery will take 10 to 15 years. Demographic momentum matters. Once people leave, getting them back is really, really hard. Okay, so why are people leaving? Let's get into the household economics. The median household income in Southern Oregon is $57,400. Here's how that breaks down. Housing, $17,400 a year. That's 30.3% of income. Healthcare, $13,200 a year. That's 23% of income. Food, $9,600. Transportation, $7,200. Utilities, $3,600. Everything else, $4,000. You add that up, and there's zero left over. No savings, no buffer. And God forbid you actually need to use your health care because you've got a $7,500 deductible that would blow up this entire budget. Healthcare is the number 2 household expense in Southern Oregon. Bigger than food, bigger than transportation and utilities combined. Now compare that to Portland. Median household income there is $82,200, 44% higher. But healthcare costs are only 5% higher. Same plans, same deductibles, similar premiums. Healthcare as a percentage of income in Portland, 16.8%. In Southern Oregon, 23%. That's a much higher healthcare burden for Southern Oregon families despite having way less income to absorb it. And after all their expenses, a Portland family has about $20,200 left over for savings, emergencies, quality of life. A Southern Oregon family? Zero. So when someone from Medford gets a job offer in Portland with 16% higher salary and better healthcare benefits, what do? They run the numbers, and they realize they'd be $6,300 a year better off. Plus, better schools, better healthcare access, more job opportunities. The decision isn't hard. It's economically rational, especially when healthcare is the swing factor. Now let me tell you about the people ages 60 to 64. This is one of the most heartbreaking parts of this whole story. This age group faces a perfect storm. Healthcare costs peak average of $18,400 a year for this age group, but income is declining because many are semi-retired or forced into early retirement. Average income for this group is $48,200, and they're not yet eligible for Medicare. They've got to wait until 65. So they're facing 3 to 5 years of the highest healthcare costs, lowest income, and no Medicare protection. The math is brutal. A typical 62-year-old couple with a combined income of $54,000 is looking at $24,800 a year in healthcare costs. That's 46% of their gross income. It's unsustainable. So what do? They leave. Between 2019 and 2024, we had a net loss of 720 people ages 60 to 64. They're moving to Arizona, Nevada, Washington, places with lower costs or no income tax. They wait for Medicare at 65, and sometimes they come back, but often they don't. We surveyed people in this age group who still live here. 42% are considering or actively planning to relocate before Medicare eligibility. 42%. And when we ask them why, 68% cite healthcare costs as the primary driver. The kicker? When we ask, if healthcare were more affordable here, would you stay? 85% say yes. These are people who've lived here for decades, raised families here, built careers here. They want to age in place, but they can't afford to. And when they leave, we lose more than just economic contribution. We lose institutional knowledge, experienced professionals, community leaders, mentors, volunteers, grandparents providing childcare. We lose the fabric that holds communities together. Let's go back to that statistic I mentioned earlier. 28% of the people leaving are healthcare workers. We have 1,133 unfilled healthcare positions right now in Southern Oregon. Registered nurses, medical assistants, respiratory therapists, physical therapists, behavioral health workers. Average time to fill a position, 4.4 months. Average turnover rate, 29% per year. And when we do exit interviews with healthcare workers who leave, 23% cite inadequate healthcare benefits as the primary reason. Another 34% cite compensation, but that often includes benefits frustration. Think about this. A registered nurse in Southern Oregon makes a median salary of $74,000. Sounds decent, right? But their employer insurance plan has a $7,200 deductible and costs them $5,040 a year in premiums. After taxes and insurance, they're taking home about $48,000. Housing costs them $17,400. That's 36% of take home, well above the recommended 30%. Average healthcare out of pocket on top of premiums? $3,200. Student loans? $4,800 a year. Other essentials? $18,600. They've got a $4,000 margin. When a medical event happens and they hit that deductible, they've got an additional $4,000 they owe. That exceeds their entire annual margin. This nurse is working in healthcare, but cannot afford to use healthcare. Meanwhile, a travel nursing contract can pay $3,000 a week with housing provided and better health coverage. That's $120,000 to $140,000 a year. What's the economically rational choice? Leave permanent employment for travel contracts, or leave the region entirely for Portland, where RNs make $82,000 with better benefits, only slightly higher housing costs, and twice the financial margin. We're caught in a vicious cycle. Healthcare workers can't afford healthcare, so they leave. The shortage worsens. Remaining workers get burned out. More leave. Access declines, costs rise, it spirals. And it's not just healthcare employers struggling. This affects everyone trying to hire. Most employers say recruitment has gotten worse over the past 3 years. Nearly 1 in 3 offers for employment in our region gets declined. Over half of those declines happen after the candidate reviews the benefit package. They see the salary, it looks okay. Then they get the benefits documents, see the $7,500 deductible, do the math, and decline. It's taking us 3 weeks longer to fill positions than the Oregon average. Most employers have had to increase salary offers to compete. The median increase is 12 to 15% higher than 3 years ago, but even that often doesn't close the gap because other markets have also increased salaries, and the benefits gap remains. When we ask employers what would most help recruitment, most list affordable health care for employees in their top 3 needs. And when we ask if there were a regional solution that reduced employee health care cost 15 to 20%, would you participate? 92% say yes. The demand is there. The employers want a solution, but the coordination hasn't happened yet. Here's another reinforcing loop that's accelerating decline. School enrollment. K-12 enrollment in Southern Oregon has dropped from 78,400 in 2015 to 74,200 today. That's a 5.4% decline. Because school funding in Oregon is enrollment-based, that means we've lost $25.7 million in state school funding. Less funding means teacher layoffs, program cuts, larger class sizes. Quality perception declines. Families considering moving here look at the schools and choose somewhere else. Families already here start thinking about leaving, and when you dig into why families are leaving, 54% cite healthcare costs. At current trajectory, we'll lose another 1,200 students by 2030. Several elementary schools will fall below minimum efficient enrollment. We're looking at 3 to 5 school closures. We've already closed 2 elementary schools since 2018. Each closure increases travel time for students, reduces neighborhood cohesion, and signals regional decline. But if we stop this migration, enrollment goes up by 2,200 students by 2030. We gain $13.2 million in funding. No closures. Maybe we reopen some of the schools we closed. Healthcare affordability determines school viability, which determines whether families want to live here, which determines healthcare affordability challenges. It's all connected. All right, I know this all sounds pretty dire, but here's the good news. This is solvable. Let me tell you about Spokane County, Washington. In 2019, Spokane looked a lot like Southern Oregon does today. Population of 522,000, median income $56,800, healthcare costs at 24% of median household income. Working age people were leaving in droves. Healthcare worker shortages, school enrollment declining. Sound familiar? Between 2019 and 2022, they did something about it. 48 employers formed a coalition, healthcare, education, government, private sector, representing 12,400 employees. They collectively bargained with carriers, implemented reference-based pricing, integrated primary care, and advocated for state policy support. Washington State expanded their reinsurance program and provided premium subsidies for middle-income families. Providence Health and Multicare did direct contracts with employers. And they did something really powerful. They purchased and forgave $42 million in medical debt. What were the results 5 years later? The population grew, and most of them were working-age individuals. They reversed the trend and are now seeing net in-migration of 2,800 people a year. Average family deductible dropped from $7,400 to $4,800, a 35% reduction. Healthcare as a percentage of income dropped from 24% to 18.2%. Medical debt prevalence dropped from 22% to 13%. School enrollment grew. Employer offer decline rate dropped from. Time to fill positions dropped. Healthcare worker vacancies dropped. GDP growth accelerated to 2.8% a year. Tax revenue increased $48 million annually. Unemployment dropped. This isn't theory. This is a real place that faced the exact same crisis we're facing and turned it around in 5 years. The total investment, coalition formation, medical debt forgiveness, state support figure $144 million over 6 years. The returns by 2030? $1.1 billion annually. That's an 8.4 to 1 return on investment every single year. Spokane did this. Southern Oregon can do this. But we have to start now. So what would it actually take? First, regional leadership has to recognize this as the crisis it is. City councils, county commissions, chambers of commerce, healthcare affordability needs to be declared a regional priority. Jefferson Regional Health Alliance, JRHA, is doing this, but to date, there are no resources and commitments behind it. Second, we need a multi-stakeholder coalition, 35 to 40 employers representing diverse sectors. Oregon Health Business Alliance, OHBA, is doing this, but that haven't hit the critical mass of 40 employers yet. Third, we need seed funding, about $800,000 to get the coalition started. Professional management, legal support, data infrastructure. Another $2 to $4 million for medical debt forgiveness, which can leverage 50 to 1 to forgive $100 to $200 million in debt. Fourth, we need state policy support. Oregon already has a reinsurance program, which stabilizes the individual market, and there is active legislative discussion about extending similar protections to the small group market, companies with less than 50 employees. In addition to this, premium subsidies for middle-income families earning $60,000 to $150,000 is needed. This isn't any one group's job. It's everyone's job, and it requires coordination. Here's what keeps me up at night. We have a window of about 18 to 24 months to act. If we start coordinated intervention now, we can achieve Scenario C, population growth, workforce stabilization, economic vitality, by 2030. If we wait until 2027, we can get somewhere between Scenarios B and C. Partial recovery. Better than nothing, but not full turnaround. If we wait until 2028, we're locked into Scenario A, demographic decline. And at that point, recovery will take 10 to 15 years. Every month we delay reduces what's achievable. Every quarter we wait extends the recovery timeline. Demographic momentum is real. Once working age people leave, getting them back is incredibly hard. They've established new lives, new jobs, new communities. Their kids are in new schools. They're not coming back easily. We can prevent them from leaving in the first place, but only if we act now. Look, I love Southern Oregon. I think most of us do. The natural beauty, the pace of life, the sense of community, there's so much here worth preserving. But loving a place isn't enough to keep it viable. Right now, healthcare affordability is determining who gets to stay here, who gets to work here, who gets to age here. And the answer increasingly is not the people we need to keep this region economically and socially vibrant. We're heading toward a future with an older, smaller, less economically productive population, fewer workers, more dependents, declining schools, harder business recruitment, eroding tax base, reduced services, a reinforcing spiral of decline. But it doesn't have to be that way. We have a playbook. Spokane did it. Other regions have done it. The solutions exist. The investment is $144 million over 6 years, regional and state combined. The return is over $1 billion a year by 2030. But more than that, the return is community survival. The return is our kids being able to build lives here. The return is healthcare workers serving the community for decades. The return is schools thriving. The return is economic vitality and hope instead of managed decline. If you're an employer, regional leader, or community organization interested in being part of the solution, reach out. We can do this, but only together, and only if we start now. This podcast is for educational purposes only, not medical advice. I might get details wrong. If you catch errors or have alternative perspectives, please comment. Subscribe to our newsletter at reimagine-healthcare.org. Thanks for listening.